Well, children aren't particularly high risk. In fact, it's very surprising to hear of the deaths of children in the flu epidemic. There isn't vaccine available normally for children under the age of 4, and children have perfectly good immune systems and normally can look after themselves.
And yet we've seen 2 children struck down in this current epidemic.
But that's very unusual.
So what can people do to actually prevent catching it in the first place?
Well, the people who are at high risk are the people who've got some form of chronic illness already. The old people in the main with heart disease, lung disease and kidney disease, and some youngsters with cystic fibrosis, asthma and so on. And they should be vaccinated before the flu season starts. And indeed we make considerable efforts to try and make sure those people are vaccinated before the season starts.
But that hasn't succeeded this year.
No, it never does succeed because flu vaccination is not regarded as a particularly high priority. And this year wasn't known to be an epidemic year, so it's rather taken us all by surprise.
So is this the fault of doctors or the Department of Health? Who?
I think it's a shared fault, really. I mean, we've had 10 or a dozen years of very, very little flu, and this has come out of the blue. We expected an epidemic 3 or 4 years ago, and it didn't occur. And I think there's a level of complacency, which hopefully we won't show next year.
So you're saying doctors should be vaccinating more people against flu?
Yes, doctors are given incentives to vaccinate children against mumps, measles, rubella and so on. But there isn't any incentive for them to vaccinate the elderly at-risk people against flu.
Well, now, do you think we've seen the peak of this epidemic?
No, I don't think so. I mean, normally, this is much earlier than we usually see flu. Normally, flu peaks in January, February. And we may well go on seeing a rising level of flu until well after Christmas.
Have you got any basic advice for people?
For those who are at risk, the groups that I've mentioned, and for old people in long-stay accommodation, vaccination is still not too late, and many of them, of course, have been vaccinated. For the rest of us, we have to take it on the chin. And if we have an attack, then stay out of circulation, swallow your aspirins or your Panadol or whatever it is that you particularly take for your flu. Keep plenty of fluids on board because you sweat a lot and lose a lot of fluid. And beyond that, there's very little that you can do.